Welcome, everyone. We're excited to have you here today. This is our 7th session of the Direct Care Resilience. So we're probably going to have about 4 or 5 more sessions after this one. And we're excited to see so many returning faces. Once again, appreciate you guys being here. For those that are new, the purpose of this project is to help expand agencies' leadership capacity to support employee mental health, and also provide you guys with some skills on direct care resilience and mental health self-care as well. Today's session is all about the effects of trauma, and so this kind of falls into that framework of personal resilience for yourself, and also how to recognize this within your staff. We do offer CEUs, social work CEUs, for attending today's session. We will send those out after we wrap up, and please fill out the evaluation forms. So we'll go ahead and get started with introductions. I'm Krista Opsdal. I'm the Project ECHO Director here at the North Dakota Center for Persons with Disabilities at Minot State. Kyle, do you want to go ahead and introduce yourself?
Yeah, absolutely. I'm Kyle Erickson. I am the evaluator for Project ECHO here at Minot State.
I'm Jody Patchen, and I am the support staff for Project ECHO at Minot State.
I'm Jessica Reiswig, and I am project coordinator on ECHO at Minot State.
Thanks, everyone. And we're really excited to introduce our presenter, Tamara Waters Wheeler. She's going to go ahead and take over sharing.
All right, everyone. I am going to get this up here and go ahead and get started. I'm really excited to talk to you about this topic. People I work with are probably sick of me talking about this topic, but I think trauma in general is a really interesting topic, and I think there's a lot of different ways to look at it. I am going to kind of focus more on what we call vicarious trauma, but a lot of what is in this presentation is based on Dr. Perry's work, because he talks, not only does he talk about trauma in general, but he does talk a lot about trauma that occurs with caregivers or people who are working with kids or adults that might have trauma or just some general neurological issues or disabilities. Let's see here. I'm going to get this going. Can everybody see those slides? I just want to make sure. Okay, Krista, I see you nodding. I am currently a school psychologist for Mandan Public Schools, and then I also teach for Minot State School Psych Program and for University of Mary, one of their assessment classes. I have been the director of the school psych program and case manager at Dakota Boys and Girls Ranch. I've also worked for Dickinson State Teachers Program and worked years ago at Minot Vocational Workshop. So I've had lots of exposure to different settings. But I do have some trainings that's pretty specific to trauma, and that's I've completed when I was at the Boys Ranch, the Wisconsin training for therapists of sexual offenders, and of course, nonviolent crisis prevention and intervention, prepare training from NASP, which is crisis intervention training. And then, as I was telling these guys before, the neurosequential model of therapeutics and education phases 1 and 2, which is if you've read A Boy Raised as a Dog or What Happened to You, or Born to Love. Those are books by Dr. Bruce Perry, who is from Bismarck, from North Dakota here too, as well, which is another really cool thing. So that's just a little bit about me. I think the reason I became interested in this topic is I've been working for a long time as a school psychologist, 23, 24 years. And then I was a social worker for 10 years. And I was seeing a lot of kids coming in that had the traditional diagnoses of ADHD or anxiety or whatever, but all the things that they said should work with those diagnoses weren't really working as well. And I was kind of looking for what is going on with these kiddos? For a lot of 75, 80% of them, it worked, but there was a small percentage that it was something else is going on. It's not working. What can we do? And so I happened to go to a conference and Dr. Perry was there, and he talked just about trauma and the brain and how that all works together. And it was like an epiphany for me. I was like, oh my God, that is that small percentage of kids and people that I'm not able to make progress with. I think some of them might have trauma. And so it's really helped me in my job to be able to understand it and recognize it. So I'm going to share a little bit of that with you. This is by no means everything, but it's just kind of a little touch. And if you have more interest, I can definitely guide you in the right direction. So we're going to just learn a little bit about how trauma impacts the brain, specifically what vicarious trauma is, and then some strategies to help prevent that in you and your staff and other individuals that might, parents or whoever might be working with kids or adults that you work with. So as far as trauma is still being debated by the psychiatric world. There's no one set definition of trauma. How Dr. Perry talks about it and how we're going to talk about it, because it seems to make the most sense to me, is this an experience or a pattern of experience that impairs the functioning of that person's stress response system so that a person is more reactive or sensitive, because behavior and the way we think is all impacted by that stress response system. And people who have had trauma or might have some neurological issues or attention issues, their stress response system is set a little different than the average person. Most of us have this mediated stress response system, but people who have trauma or other issues going on, they never really, they might kind of go up here and then they learn some strategies and they go down, but they never go all the way back to normal until we've done some interventions to get them down. But their stress response system kind of gets a homeostasis that's up a little bit higher than normal. And so that's Dr. Perry's kind of definition there. It's also, for the neurosequential model of trauma, it's important to understand that the brain is really what controls everything. It controls our thoughts, feelings, actions, and connections to the world around us. And one of the things to remember about this, which will help you when you're thinking about behavior and how it can cause trauma to your staff, is teaching them that the brain is wired differently when people have trauma or other neurological issues. And they're not and in fact, people will say they're choosing to have these behaviors, but actually their brain is wired how they learned it based on the experiences that they've had. And the key thing about this, actually, you guys, is they are choosing their behaviors, but they're choosing it based on false information in their brain and their stress response system. So that's why I think to people, it looks like they're choosing to be jerks or they're choosing to have these outbursts, but their brain is wired such that that's the only choices they can make because they've had those experiences. And so understanding how that brain works really helps us understand ourselves and the people that we work with. And I'm not a neurologist, so I'm just going to give you kind of the basics. If you really haven't read A Boy Raised as a Dog or What Happened to You, Dr. Perry, in What Happened to You, Dr. Perry and Oprah, it's like they're having a conversation. They will explain all these hard neurological concepts in a way that sounds like you're just listening to them talk and you'll understand. They break it down really well. The brain develops from the bottom up. So when you're thinking about infants and trauma in utero or in those first few years of life, it is important to know when the trauma occurred. If it's constant trauma or if it was a one-time thing, people actually recover from one-time trauma, even if it's like the worst type of trauma, faster than trauma that is consistent through a period of years. So for example, if someone is, not that it's, I don't want to make it sound like it's not as bad because it's definitely an issue, but like if someone has one instance of sexual abuse, they might recover better than a student who sees domestic violence for 3 years of their life, because the brain growth will be impacted all from the period of time that the stuff occurs. Or like if the mom has one drink while she's pregnant because she doesn't realize she's pregnant, they might have less issues than someone who the mom drinks the first 3 months of this child's life and is kind of checked out and not building that bond with the baby, if that makes sense. So it's important to know how the brain develops so that when you look and you're working with people and you're working with staff especially, and if someone passes away at work, your staff might recover from that better than if they're working with a client who has behaviors for 6 months in a row, if that makes sense. And the other thing about the brain is we used to think, and some of you might not be old enough to know this, but we used to think that the brain really stops developing after age 5. And we now know that that's not true. It continues to develop into, can be the late 20s, especially that frontal lobe piece. And there's also a huge surge of rewiring that's done during adolescent years. So it's really good to know that with your staff, depending on the ages of the staff you have working at your organizations, there's different, people can always change their behavior, but there's also things to know, like as a supervisor, if you have a bunch of young staff, this is what you're going to do for it. If you have maybe older staff, you might need to have longer training and more consistent training for them to overcome some of their behaviors. Or if you work in a really crisis situation, the young staff might adapt. You might just need to show them about the brain and say, hey, we're going to have a support group once a week. Older staff might need something different to change their thought patterns and behavior with that. So, and this will make more sense as we kind of pull it all together. This is kind of Dr. Perry's brain drawing. It doesn't look like a brain, but it looks like this bottom part is your brain stem, and it kind of goes up. And this is just on the side is kind of some of the things that are really controlled in each area. And so the important thing to know is obviously the brain works together as a whole, but if you have a period of time when there's trauma with a child, and say that's the period of time when the diencephalon is developing, there may be more damage to that area. So you're likely to see motor regulation, appetite, and some of those things impacted. Now with your staff, most of theirs is going to be up in that cortex and limbic system if your staff are experiencing trauma. So you're going to focus on different strategies to help them than you would if it's down here in the brainstem. Although it's important to remember that if we're stressed, we do drop down to that brainstem a lot of times in our response. So that's just kind of a general idea. The other thing with staff and kids and anyone you work with really is these are the three main transmitters down here: dopamine, norepinephrine, and serotonin. A lot of times we have staff and they may show signs of anxiety, or they may show signs of ADHD, and we think, well, if they would just go to the psychiatrist and get medication, they would be fine. They wouldn't be traumatized. They wouldn't. It goes a lot deeper than that. First of all, medicine is not a guarantee, and I'm not against meds. I feel meds help, but you have to have a psychiatrist or doctor that understands this very well, and you have to have the exact right medicine to impact the exact right neurotransmitter or in the exact right part of the brain. Otherwise, meds won't work. And that's why a lot of times when we hope meds will be the all-time solution, but they're not. And it takes sometimes 3 or 4 different meds to find the right one, even if it is the solution. So again, I'm not against meds. I'm just saying that you have to really, it's not as simple as just going in there and getting a med and it's all one and done. And your staff need to know that too. because a lot of times we do think, well, if we go get meds for our anxiety, it's going to be fine. Well, there's a lot more to it. So it's a very precise type of thing when it comes to the brain. So this is just kind of like a figure that you guys can keep and it helps you picture the brain a little bit better as far as what we're going to talk about. There's two ways that trauma affects people, and one is the insult during brain development, which we see in young infants, but the other part is relationships, and that's what you're going to see with most of the adults and staff that you have, the direct care workers, and it has something to do with the relationships, whether it's a relationship with the caregiver and the client, or relationships between staff, or relationships between administration and staff, or something that happens, but it all is because of relationships. If you don't care what someone else thinks, and there's someone out there that you don't have a relationship with, it's a lot less traumatic if something would happen to them than if it's someone who you have a relationship with. So really it's all based in relationships, and not saying they're good relationships, but it's all about relationships, whether it's a really negative relationship or a really positive relationship. The only exceptions to that are kind of when you think about like COVID and things like that. But even that is dependent on relationships, because it wasn't COVID itself, the sickness, it was the loss of relationships for people dying. It was the isolation. So it's still all relationship based, if that makes sense. Relational health, this is kind of what I said. It happens in relationships, and it's how trauma is overcome as well. Relationships are what are going to help people overcome trauma, and that is especially true of your staff that you have working. And the quality and quantity of interactions matter. We used to say, well, as long as your quality of your interactions are good in a relationship, it's fine. But also quantity matters as well, especially depending on the person. And there is a video here. I'm not going to show it because it's time consuming, but you can go on there and look at it after. Vicarious trauma is actually an occupational challenge. It's for people that work where you guys do. They give examples here of law enforcement, emergency medical services, but it's really anyone that's working with individuals who have either had trauma themselves, or have disabilities, or have a lot of behavior issues. And you can get it just from listening to people recount their trauma. Like, I specialize in behavior and trauma, and I listen to kids and adults tell me these horrible things that happen. And it does impact you, especially if it's constant. And again, this goes back to, if I hear it once in 10 years, I'm not going to be as impacted. But since I hear it like on a regular basis, I'm probably going to experience some of that. Just from reviewing case files, some of them are so traumatic. Hearing about or responding to things, like we respond a lot of times if we have a crisis, if we have a suicide, if we have any of those kinds of things happen, a fire, even training scenarios sometimes, anywhere where there's some sort of trauma. And it doesn't have to be death and injury. It can be all kinds of different things. When you respond to vicarious trauma on a regular basis, your brain will kind of go two ways, because your brain is use dependent. So what you experience and do and practice is how your brain wires. Okay. You can rewire it by doing the opposite, and it's got to be repetitive, lots and lots. That's why we say practicing, role modeling, all the things we hate to do are the way you rewire your brain, right? And that's why we say too, like, you can't say to your staff, don't do this, without giving them, do this instead. Okay. Because you got to rewire and do the opposite in your brain. And so people either become more fearful, or they can become more appreciative of things, or it can be a combination of both. So I'm going to show you like just a little model. This is just a work-related trauma exposure visual, just so you can kind of know you're going to result in a world view change regardless if you're constantly exposed to trauma. But there can be a spectrum of responses, and you can get really negative, like where you get tired, you're just kind of brain dead. That's kind of, and it's, people don't understand, like, when you have vicarious trauma, you'll see the symptoms are things like you can't focus, your brain seems foggy, your memory starts to go. It's not always like outburst behavior that people think about. It can be those simple things that we think, oh, we're just stressed out, we're tired. Yes, you are, but it can be a form of trauma. You can kind of have a neutral, like some people are really good at separating themselves from their work. And so some people can be kind of neutral, they just manage it and it's great. And some people become much more positive. Like, for example, I lived in New Jersey for a year in a Beat the Streets program, and literally there was 5-year-olds that were being given drugs. There was parents that didn't show up to pick their kids up because they were high or drunk or whatever. It was horrible. I was even like, someone shot at us, like up in the air in trees, but I mean, it was horrible. And it was traumatizing. But when I came back, I was so much more appreciative of everything that I did have, because I didn't have a perfect life, but I had a pretty good life. My parents are still married, and we didn't get everything we wanted, but we were fed and clothed and whatever. And so I was a little bit not appreciative, like most 19-year-olds can be. But when I went there and came back, I was much more appreciative of things. So you can have like different responses, and they're all trauma responses. But the one that really, can cause the most issues is obviously that negative trauma response. Anyone working with survivors of trauma, violence, or even just a lot of behavioral things is vulnerable to vicarious trauma. And it's dependent, the frequency, intensity is dependent on a lot of different things. Their past traumatic experiences, like you might have staff that come in that had a lot of trauma as a kid. Maybe they resolved it completely and they're doing great, but if they start getting exposed to a lot of trauma at work, they can regress or start having issues. Social isolation, staff that come in and have a big support network, lots of family and friends that live close by, often do better dealing with trauma than staff who say they moved across the country for a job and they're here all by themselves. People who already have a tendency to avoid feelings or withdraw or not express their feelings are going to be more at risk. Like I always say, I'm probably not a big risk for trauma, because I'm the type, like something happens, I vomit it out for about 3 days, I talk about it, and then it's over and done. And luckily I have good colleagues and friends that will listen to me, but after about 3 days of complaining or talking about it or problem solving, I'm good. But if people stuff it in, they're more likely. And those of you, probably a lot of you have heard about the ACEs and how stress and trauma is related to physical things. Like people that hold it in, they're not going to feel good either. They get a lot of stomach aches, headaches, just feel gross. And so people that kind of handle stress that way already are going to be more at risk. Also, if we don't prepare our staff, we're not like training them properly, we're not supervising them along the way. And like, if your job is like anywhere else, we provide a lot of training in the beginning when they're just starting and they're never going to remember it all. And then we don't provide training for another year or 6 months. And so we have to change up the way we do training. And also we need to like support them as they're going along. And just an example of that, like from even where I work, is we decided when people came in, they weren't getting like the training they needed for administering academic assessments. Just because universities didn't have money and didn't have staff, that was kind of a weak area. So we decided to do training with them. So the first year we like did these long, extensive trainings, and honestly, were so boring. I almost didn't like it myself, and it wasn't that successful. The next year we added in way more hands-on stuff. It was a little more successful. And then we're like, but we're still missing a piece, because we might train them and then they don't do an assessment for 2 months. How is that helpful? So we decided we would assign a person to each of the new staff. And when they did their first assessment, we went with them and just encouraged them, helped them, and then reviewed it with them. And if they wanted more assistance, if they didn't feel they still had it, we offered to be available. So it's the difference in those types of things with training that you can change up. But people who are just shoved and given a quick training and it's not followed up with, or they aren't given time to process or follow up again, they're going to feel unprepared, and that they are not as well trained as they should be, and then they're going to struggle. They're more at risk. Newer employees, less experience, constant intense exposure. We kind of talked to that a little already about, and not being able to like get breaks or get time off. Like with all the shortages and staff going around, your staff, if they're not getting regular days off like they're supposed to, they're going to be more at risk for trauma because they're working, and it might help. Yeah, they like the money or whatever, but it's not great. That's why with a lot of jobs like doctors and pilots and stuff, you cannot work double shifts. You got to have time in X amount of time in between. And then also, if you work somewhere where you're not like, if you guys aren't providing time for them to discuss the trauma and process the trauma, and I'm not saying that you got to sit and let them complain for 2 hours about it, but giving them a time to say, hey, this happened, let's talk about it a bit. And even if they do spend a bit of time venting, that's okay. Just long as you don't let them sit there and admire the problem for 2 hours. But it's really important that they do have that time, and even just like arranging for them to go on their own. Like there doesn't always even have to be administration, but having them go and be able to like just kind of talk about it, deal with it, and process it in their own way is important. Because if you don't provide that, they are going to be more at risk. Common symptoms of vicarious trauma specifically is, it can look different in different people, but some of the things that are kind of stand out across different individuals is difficulty managing emotions. Like, for example, I was just talking to my sister-in-law, like sometimes, we just leave it and we don't talk about it. And then all of a sudden something small happens and then we snap. That's that stress response system that's way up here in people with trauma. So normally when it would take a lot more to make the average person get up to that point, people who are in this high stress response system, who are stuffing and not able to manage, one little thing just sets them off and they have this big explosive behavior. And you see it with staff a lot of times, like kids that I work with can be doing horrible things and it's all fine, but then all of a sudden, because it continues on for like 2 months, then the staff will just snap and do something they would not normally do. Like they'll yell or scream at the smallest thing. And you're like, why are you getting mad about that? You didn't get mad about this, a week ago. Feeling numb or shut down. Like I always make a joke. Yeah, I don't show much reaction because I'm dead inside, but it's not really true. It's just I've learned not to show it. But some people, sometimes if you're exposed to too much trauma, you just get to the point where you're like, you withdraw. A lot of tiredness, sleepiness, or not sleeping at all. If you have staff coming in looking constantly tired and they're saying they're not sleeping, that's an issue. Even if they're handling their job perfectly, you might want to still have them talk to your employee assistance program or whatever. Physical complaints, like I've talked about, headaches, pains, getting sick lots when they normally never used to get sick very often, being distracted. And you can, depending on what you're doing, but like, just think about like, if you have a staff who has so much trauma and they're super distracted, but they're driving clients around, you really have to consider those kinds of things. And just like a feeling hopeless, and I'm not saying to the point of like they're suicidal, but just feeling like, oh, I'm never gonna get this kid to change their behavior. I'm never gonna get this client to do this, and just being super negative all the time. Relationship problems, not getting along with other staff, or even just coming into work and reporting like that they're constantly fighting with their husband, or their kids are getting on their nerves all the time. Worrying a lot about work or their family or their safety of their kids at school, or just any of those things that come up, just things that could be a danger, but they don't normally worry about, but they get kind of obsessive about. It talked about increased irritability, aggressive, violent outbursts. If you see a real increase in like going out and partying, starting to do like something that's really, if your staff member all of a sudden is like, they get divorced and then one day they say, oh, I'm going to try skydiving, and not saying you're going to like freak out and tell them they need to go to a counselor, but it's definitely worth having a conversation with them, like, and getting a little more information. And you can do that without being too intrusive. Just not wanting to participate in activities. Like if you have social activities at your work where you go out and normally they used to always come and then all of a sudden they're never coming and there's not an outlying reason, like they have a sick parent or something. And just avoiding interactions. Like you can work somewhere and only interact with people when you absolutely need to. If you had someone who was very happy all the time and they were always saying hi everyone and greeting everyone and sitting and playing games with clients or whatever, and then all of a sudden they're just like doing as little interaction as possible, that's a sign too. And then just like if you guys are familiar with PTSD, you can have a lot of like even hallucinations and different things, but that's pretty severe trauma. Not typical, but it can happen depending on the situation. That's more common though, like with police who've been in like gunfire and firefighters and things like that. So that's the part that, it's like, oh yeah, that's all well and good, but what can we do about it? Because, we can theorize about this stuff on and read about it, but what do we do? And it's not as hard as we think. It's more about the timing of what we do. The things to do or, make sure you take care of your own body as administrator. Here's the thing, Dr. Perry talks about this all the time, co-regulation. If you're feeling traumatized and unregulated as an administrator or someone who supervises or works with clients directly, if you're in a bad state, they're going to be in a bad state. You have to co-regulate. That's the most important thing with keeping your stress down. So if you're going to try and get your staff to take care of themselves and do certain things, you have to do it with them. Not necessarily be with them every minute, but I'm saying if you see it as a general staff, they're looking traumatized. If you say, hey, we want to help you in any way we can, you might want to hire a yoga person to come in and do yoga with them once a week, depending on your money situation. Like or just not even hire someone, but just say, hey, like we have teachers that once a week, they do yoga at school. They have they just bring a video in and they do it together just for, to de-stress. So taking care of your body, and I'm kind of bad at that sometimes. Just being more aware, like some people like mindfulness, some people like yoga, some people just like to listen to music, taking that time to yourself. And some people feel bad about taking time to themselves. And I'm not saying that you need to be having a girls' weekend every weekend, but you might want to take 10 minutes to just sit and do something that's relaxing to you. And allowing yourself to be social. Okay, when we get stressed and when we are like in trauma, we pull back. We don't want to be with people, but that's the worst thing to do. Trauma is resolved by relationships. You have to force yourself to get out and do things. And that's the same thing. When you have that staff, you're having that work gathering and you have that staff that doesn't want to, you got to like convince them, encourage them, tell them how much you want them there and get them out there. Then obviously therapy is always an option. Time off. And then the trauma activities we use with kids are good to do with your staff. I'm going to say that time off, you want to be kind of careful because if the person's already socially isolated, you're not going to want to suggest time off to them. And therapy too, therapy is great, but that's once a week. Okay. it's better to try and find things that you can insert into the everyday workplace. Whether it's like a 10-minute, like, okay, and this is an extreme idea, but we've had people come and hire someone to give 10-minute neck massages, and staff can come in at random. Or you can give them, like, put things out, like a box of fidgets or stress relievers, and say, hey, everybody, today I want you to take 2 minutes out of your schedule or 5 minutes out of your schedule and come and use this. Or you can share like apps that you have that are calm apps. Like because those things can be used throughout the day when people have 2 or 3 minute downtime. And those are better than a once a week therapy session, if that makes sense. Not that you don't still go to therapy. I'm not saying therapy is bad, but that's once a week, and we need to follow through with a kind of day-to-day things, if that kind of makes sense. So some of the things, and I'll hopefully have a little bit of time for questions at the end, but some of the things like Dr. Perry, drumming music, letting people listening, your staff, if they have a break, having like a list of drumming music videos available that they can click on, or giving them some ideas about Spotify. And I'm going to tell you guys, some of you might be laughing. I laughed at this. I had a group of boys. Some of you may have heard this. I think I told it last time I presented, but I had a group of 2nd and 3rd grade boys that I don't give up easy. And I don't care if kids are pretty much standing on their head, as long as I know they're engaged when I'm teaching them in group. But I had this group of boys that I was like, I literally was going to tear my hair out. I had like 2 meetings with them, and I thought, I'm like, I can't do this. I'm going to have to quit this group, And I had to meet with Dr. Perry regularly when I was doing with the training, and I happened to have a meeting with him that Sunday night. And I'm like, these boys cannot focus and sit still no matter what. They're not like naughty. I can't even get them to engage at all. And he's like, try some drumming music. And I didn't laugh in his face, but I kind of scoffed, And he's like, I'm telling you, just try it. And I'm like, okay, I'll try it. And he gave me instructions. Well, that Monday I had group, and I played the music, but I played it too long, and they were almost asleep by the time I was done with them. I had to wake them all up and have group, but they were so engaged, you guys. I couldn't believe it. So then the next week I just cut the time down a little bit to about 4 minutes. And I have that group, those boys did so well after that, but I just had to play that music at the beginning of group. So now when I have groups, if I have a group like that, I do it. I also just use it to teach them as a strategy, because they can all go on YouTube, and your staff all have free access probably to YouTube at home or on their phones or whatever. Drumming music is good. And I was not a believer in the beginning, but I am now, because if you would have seen those boys before and after, I actually have a video. I should probably incorporate that sometimes when I'm doing it. So for regulating your stress response system, your brain in general, drumming music. Here's a list of resources or YouTube videos that you guys can use, or even at the beginning of a meeting, a staff meeting. People will think it's weird at first. They will, but you'd be surprised how quick they become believers. Any music listening and playing, and not blasting music when they're trying to do work, but when they're having lunch or when they're doing activities that don't require certain types of focus. And that's dependent on the person, because everyone's brain's wired a little differently. But I know in my life, I can listen to music during certain things and it's calming. And there's sometimes when I need quiet. Staff, if they're doing something that doesn't require them to be focused on a client, they can listen to music. You can have music going in rooms during certain activities. You have to kind of try that and make sure it's appropriate and fits the situation, but definitely having music available. Music lessons. Like I know there was one organization I worked with that experiencing quite a bit of trauma, and they had someone come in and actually teach guitar just for 6 weeks. And staff could do it if they wanted to. And, you know, we don't all always have money for that, but if you have someone who knows guitar and would be willing to devote a bit of time to do that, or some other simple thing like that, or even staff who say, I need a hobby so that I can deal with my stress. What are some ideas? Music lessons are a great thing to suggest if they're looking for something and can afford it. But rhythmic exercise like yoga too, and that's free. You can get a million videos. You can do yoga in the morning. If you come in early 15 minutes, we'll do 5 minutes of yoga. If you want to form a class, and you don't make it mandatory, because obviously there's people that don't want to do it, but just offering some of those options to your staff. Hey, I'll have a video if anyone wants to come. Exercise is always good. Like, these are not rocket science, right? You know, I'm telling you guys this stuff like it's some big new thing, but none of this is. But I think a lot of what it is we don't take the time to do these things. And you know that a lot of times people who exercise regularly, they don't often have as much stress as some of us who don't. So even encouraging, hey, does everyone want to go walk at lunch? Like my ex-husband, they have a big walking path. He works at Basin, and he said, like, it's so nice when they go out in a group and they just go for a walk at lunchtime. You know, you can incorporate a lot of those things, and they're not don't cost anything, but you can just say, hey, it's first shift's lunch. And like someone could do it if people go on shifts, obviously, for lunch in different organizations, have someone kind of in charge of it each shift. Let's go for a walk. Let's all go out and just encourage that. Taking breaks, just normalizing a lot of this is what is the key. Like, if I just stand up and start doing 10 jumping jacks and everybody looks at me like, are you crazy? I'm not gonna do it again, right? But if we normalize, okay, when you're feeling tired, let's move around a little bit. And honestly, in most situations, there are clients that would benefit. You can incorporate the clients in that as well, depending on, you know, their mobility level or those kinds of things. But dance, you know, dance costs a lot of money if you take a class, but some of my teachers, even in their classrooms, will say, okay, we're going to have a 2-minute dance party, and they dance around the room when kids are getting kind of stressed out. Adults can do that. And it sounds maybe dumb when I'm saying it, but it actually helps. And if someone's looking for a way to distress and they want a hobby, dance is another way to do that. There's a lot of ways that you can incorporate that. Depending on your clients, you can have a little dance party with your clients. There's a lot of things. You can have a dance party after work as you go out to the dance club, you know, whatever it takes, you can incorporate those things in. Connecting with nature is another big one. You know, a lot of the research Dr. Perry did said that we are becoming disconnected from nature, and nature is a regulator because it ebbs and flows, and things kind of happen in a cycle. And anything that you can do, even if it's just telling your staff, hey, let's go eat lunch outside in the summer. It's hard to do in the winter in North Dakota, or go take a quick walk outside, or allowing those opportunities throughout the day is going to be good. And not like, I think part of it is, you know, everything is so automated. Like you get 15 minutes break. Oh, Jessica, that's great. Yeah. So you have to give a little leeway, you know, maybe they want to take 2 5-minute breaks and go outside and walk. Like a lot of it depends on scheduling. I know as administration and people who are working in organizations, you don't always have those options, but you can make it work if you kind of brainstorm it a little bit. Jessica said that she was at a conference where they did laugh yoga over Zoom during COVID, and it was amazing. Yeah, like there's all kinds of things that you can do that will be beneficial for your staff that don't cost a lot of money, because I know people don't have a lot of funding a lot of times. Here's also 3 books if you like mindfulness, and mindfulness can be done really anywhere. I really like 10 Mindful Minutes by Goldie Hawn, and actually a doctor, Holden, she wrote it with, but it has a lot of like just 2-minute things that you can do to reduce stress and anxiety. You know, if you have a high trauma job and you have staff that are really struggling, do a book study on one of these books. If people like mindfulness, you know, again, you don't make it mandatory, but it's an option for people. And if it's something that they read the first chapter and they're invested, they'll keep doing it. Don't make it into a lot of work, like they got to do a paper and all this other stuff, because that's just more stress. But just say, hey, we're going to read this book and meet twice, you know, and talk about it, things like that. Or you might even just find things in there that you want to do, like little activities at team building. You all have staff meetings usually. Take 2 minutes at every staff meeting to do a little activity. And then if people like it and it works, they can use it, you know, on their own. But my last thing I want to say before I took a little more time, but before I ask about questions, is just remembering that, like, for trauma of any kind, connectedness is the key. Being connected to others is a better predictor of your health than any adversity or trauma that people have faced. So we need to just be with each other, celebrate our diversity, and learn and work together. You know, I think a lot of times today's society has gotten to the point where we're so fast paced, we're so separated. North Dakota is, I think, still better than a lot of places. And as far as a lot of people still live by their families, but there's a lot of people that come here that have no family or anything. And we need to, instead of separating ourselves, we need to come together. That's why, like, even with teachers, we have a lot of issues. Well, people don't want to be doing their teacher job at night. Well, I get that. You have families. But years ago, when we lived in small communities, people brought their kids along to everything. And it was a community thing. So you didn't really feel like you were working all the time. And I'm not saying that we have to do that with everything. We do need to delineate our own time and have time to ourselves. But we just have to remember that all those interactions with people, whether it's during work, after work, or whatever, are how we will be healthy if we're connecting with the right people and people that are treating us well. And Dr. Perry always says the superpower of humankind is our ability to connect, and we can regulate each other and reward each other in our relationships and make us better people. So that is it. That's all I have to say today. I hope that you found some little tidbit of something that might be useful. If people have questions, I can answer them. Or if you want to just kind of show your video, Krista, you can give them my email, and they can contact me as well. It's whatever works for you, kind of. So
Thank you so much. Is there any questions? Feel free to unmute or put them in the chat. Trauma is a very complex. Oh, you guys heard Tuna. I'm sorry, my cat's here. Trauma is such a fascinating and complex topic. So I think you did a really great job kind of outlining it. When I first started learning about it, I was very surprised at some of the symptoms and the symptoms of it. So I highly recommend that everybody keeps that in the back pocket and kind of looks at that from time to time, because I know that I've experienced trauma in the past, and I had a lot of those symptoms and I didn't know what to call it. I literally thought I was losing my mind. Like, I couldn't remember anything. I felt that numbness, and I was definitely coping with substance use. And once I kind of learned about trauma and I was able to like kind of identify it a little bit better, I was able to kind of move on and try to move into some of those more healthy coping mechanisms. So yeah, I just appreciate all of that. And I think we're going to try the drumming music before the next session instead of my happy, quirky music.
okay.
And I also just love the thought of you scoffing at Dr. Bruce Perry.
Well, it was not my best moment, but I just was, and not that I know music can make you in a better mood and everything, but for some reason I just thought these kids were probably beyond that. And it worked. So yeah, try it out. It takes a couple tries, but
Yeah, that's awesome. So I don't have a case presentation for today because in the past we've had people express that they want this session to be a little bit longer, and we found this really great video that kind of goes well with everything that we had talked about today. So I'm going to share this with you guys, and we'll include this in the additional resources as well. And if you have any questions that pop up, please feel free to put them in the chat while we play this video really quick.
Let me know, but first I'm asking that you like this video if you like this type of content, and I'm going to jump right into those 8 signs that you may be traumatized. Number 1, disassociation or numbing. This is when I have clients come to me and say, I don't feel anything. And sometimes clients can actually be very high functioning and still have this feeling of numbness. I've had clients explain it to me. It's like I'm moving in the world and things are happening and my body might be responding, but my mind is just not connected with what's happening in my body. Maybe there are certain things that they know should scare them, or there are certain things that they know should bring them pleasure, and they just cannot experience that. That's because your parasympathetic functions have shut down. And that again can be a result of trauma, is that you are unable to fully feel what's happening within you. It could be touch even, but really I'm seeing it more often with emotional responses, just that feeling of numbness, almost like an out of body experience. I can do a whole separate video talking about ways to address these trauma responses, but I will say with parasympathetic responses, if you've been shut down, there are certain things that you could try to kind of re-engage your parasympathetic system. Something like acupuncture, for example, might be a way to reconnect your mind and body so that you don't feel as disassociated. Here's a big one I want to take a little time talking about, which is that your body is always in an aroused state. And this is really in response to danger. It's a perceived sense of danger. And so if your body is constantly in a state of arousal, imagine when you are like running and you know your heart is beating, you're sweating. Imagine someone whose experiences that feeling 24/7. No one can survive with those high adrenaline levels, with those high cortisol levels. No one can survive doing that. So they try to find alternative ways of calming down, since their body is not able to naturally do it on its own when it recognizes that there is no sense of danger. That's the problem, is that the body is not recognizing that you're no longer in a space of danger. So how do they address it? They try to manually calm down. This is where I might have clients who are perpetually masturbating, for example. The feeling of masturbating is giving them a break from that aroused state. They might turn to drugs to calm down, alcohol. They might cut themselves, right? So sometimes we can't make sense of why a person would become a cutter, for example. But if your body is always on high alert, then the process of pain, at least, is a very streamlined, centralized feeling that you can understand and make sense of. And it can distract from the feeling of anxiety and angst that they're having within their body with no explanation. Similarly, starving yourself might be another way of centralizing that pain into your stomach. And so these are ways that we try to address that feeling of arousal to calm ourselves. And so sometimes, especially with people who might have to deal with addicts and things that might not make sense to them, why you would continuously make these choices. But when you're dealing with so much arousal in your body that it's overwhelming, you look for a way of escape for dealing and processing. So that I thought was very interesting from the training. Number 3 is self-loathing. Another concept that van der Kolk would often go back to is that when a person is traumatized, whether that be in childhood or adulthood, whether it be physical assault, whether it be sexual assault, whether it be a natural disaster, whatever form of trauma we're talking about, people often find a way to blame themselves for their trauma. So had I put my seatbelt on, had I just not talked back to my parent, had I XYZ, then maybe this trauma wouldn't have happened to me. So self-loathing is another major predictor that a person is still in a traumatized state. Number 4, you might be rigidly stuck in the past. This is really the direct work of your thalamus and your prefrontal cortex in the brain. The thalamus is your sensory integration. So this is how you recognize, for example, if you are touching a pet, you are feeling fur. Or if you hear whooshing sound, you might be able to recognize it as a car. That's what your thalamus, as part of its job, is that sensory integration. So you can make sense of the things happening around you in your senses. Your prefrontal cortex is the timekeeper. So this is the part of your brain that helps you view things chronologically. When you have experienced severe trauma, you may be in a position where you're rigidly stuck in the past in ways that we'll talk about later that affect you in other ways, but essentially it can be hard for you. For example, if you see a long pipe, your brain rationally would let you know, okay, I'm near a water hose. But if you have been bitten by a snake in the past, or you had a family member who maybe told you a story that traumatized you about them being bitten by a snake, you might jump, scream, run, think that you're seeing a snake, right? And if this is continuously happening where you're seeing something that is relatively benign, but you are jumping to moments in the past that this was actually a danger for you, then that might be another sign that you are traumatized, being rigidly stuck in the past, difficulty integrating what's happening to you right now. Number 5, speechless terror. Speechless terror is activated by a certain part in our brain where when we are in a certain situation that feels traumatizing or feels dangerous, we might resort to not being able to speak at all, becoming mute in certain situations. So if you recognize that maybe typically you're a very verbal person and able to speak, but in certain situations you completely shut down and cannot speak, that might let you know that there are situations from your past, or maybe the situation you're experiencing within that moment, that have been traumatizing. Next, loss of self. This is a really important thing to pay attention to, because one thing that Vanderkolk talked about in the training is that when you've lost a sense of yourself, that also means that you lose a sense of other. If you can't acknowledge or discern what is you, it's hard for you to separate and distinguish what is other. So there might be situations where that situation or person might be a danger, but you view yourself as the danger because you cannot distinguish between the two. So if you feel like you have lost a major sense of yourself, your identity, who you are, particularly within the world, so you can make sense of the world around you, that could be a result of trauma. Physical immobility. One of the things that Vanderkolk talked about was having certain traumas be physical, where you are actually told by your perpetrator not to move. And so if you are in certain situations like that could be physical or sexual trauma, maybe even if you were in a car accident, something like that, where if you would have moved, then maybe you would have gotten cut with a shard of glass, or maybe if you were getting a spanking and if you would move, you get hit in the face, hit in the eye, you learn that your safest response is not to move at all. So again, if you find yourself in certain situations, let's say you're driving and you've been in a car accident before, and you notice when a certain color car passes you, you completely freeze up. That physical immobility may be a sign that you might have trauma work that you need to begin the process of doing. And lastly, the most important one for me as a therapist, the thing I needed to hear to process some of the work that I'm doing with clients, is difficulty learning new information. This is one of those things that was very relevant to me as a therapist, because often I have clients that I'm seeing where it feels like we're making breakthroughs. It feels like they are learning new things that should help them make decisions that they're more proud of. But what we see instead is that there's almost this cyclical nature to break through, get into real world, practice the change, get right back to their regular homeostasis or status quo. And so when that happens, it can be really frustrating because you're thinking, hey, I was really excited to write this part in the progress section of the note, and now we're right back where we started. But when a person has experienced trauma, it's difficult for their mind to process new information and learn new information. That's why a lot of times when you are working with or dealing with people who were traumatized, especially at young ages, some of the ways that they cope with that might feel immature to another person who is more fully developed. And that's because their learning process may have been stunted at that age where they're not continuing to develop due to having to be preoccupied again with a lot of the things we talked about earlier. If you're rigidly stuck in the past, if you can't turn off those alarm signals in your body, that's so much that you're having to deal with on a consistent basis, that being able to actually be able to incorporate and integrate new information into that, the timekeeping, that chronological understanding of life might be impossible for them at a certain point because they're overwhelmed with things that have happened to them in their past. So those are 8 signs